Hello friends, welcome to another YouTube video from SMNP Reviews. I'm Ashton, one of the instructors with the SMNP team. I'm also a family and emergency nurse practitioner, and in this video we're going to be discussing basic interpretation of a CBC or complete blood count. And so for a deeper dive into this topic, definitely check out one of our review courses. Also be sure to click that subscribe button so you don't miss out on our latest videos. First, let's review white blood cells, or WBCs, also known as leukocytes. The normal white blood cell count can vary slightly among different labs, but the general reference range in adults is 4,000 to 11,000 cells per microliter. And do y'all remember some causes of an elevated white blood cell count? I'm definitely thinking about things like infection, but what about things like injuries, inflammatory conditions, autoimmune conditions such as rheumatoid arthritis and lupus, and even certain medications such as corticosteroids? Those can all cause an elevation in the white blood cell count. Now, what are some reasons that the white blood cell count might be low? Conditions such as cancer, recurrent infections, and certain medications such as antipsychotics. Now let's switch gears and discuss red blood cells. What is a normal red blood cell count? Remember, this is going to vary slightly based on the patient's sex, but roughly 4.5 to 5.5 million red blood cells per microliter for men and 3.9 to 5.1 million for women. What about hemoglobin and hematocrit? Recall that hemoglobin is what enables red blood cells to transport oxygen throughout the body. Hematocrit is simply the percentage of red cells in the blood. A normal hemoglobin level is approximately 12 to 18 grams per deciliter, with women on the lower side of normal and men on the higher side, while the hematocrit level is approximately 3 times the hemoglobin level. So this is normally around 36 to 54%. When the hemoglobin and hematocrit are low, we are most likely dealing with some type of anemia, right? But what if they're high? What are y'all thinking about then? Definitely polycythemia, also known as erythrocytosis. Y'all have got it. What are some causes of polycythemia? I'm thinking about smoking and hypoxia. It can also be familial or the result of a genetic mutation such as polycythemia vera. Other causes can include high altitude, sleep apnea, and kidney or endocrine disorders. So if you have a patient with polycythemia, this is definitely something we want to investigate further and refer out to hematology. Up next, let's talk about platelets. Platelets are cells that clump together and form a clot when they recognize that there's been damage to blood vessels. What's a normal platelet count? Approximately 150,000 to 400,000. So what happens when the platelet count is low? The patient is said to have thrombocytopenia, and do y'all remember some causes of this? Some that come to mind include infections, leukemia, pregnancy, alcohol use disorder, and disorders of the bone marrow or liver. And if the platelet count is low, what does that put our patient at risk for? Definitely bleeding. Now, what about patients that have the opposite problem? They have too many platelets. These patients are said to have thrombocytosis, and thrombocytosis is far less common than thrombocytopenia, and it can also be caused by infection, but it can also be caused from an underlying pathology such as cancer or a genetic mutation. And if our patient has too many platelets, what do we worry about? An increased risk of clots, right? Therefore, patients with persistent thrombocytopenia or thrombocytosis should be referred to hematology for further evaluation. There are several more components of a CBC to cover for your exams, so be sure to check out our courses for a more in-depth review. I hope you found this video helpful in reviewing just a few of the basics. Also, if you are looking for an amazing free community of students just like yourself prepping for boards, definitely make sure to join our Facebook group, and these will be linked in the description below. And here are my references. And that wraps up this video. Be sure to subscribe for our channel and check out our other videos. You are so close to becoming a real deal NP. We are rooting for you.